Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your week. Once again, you've made it to Wednesday. Congratulations. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It is Wednesday, May the 12th, 2021. I'm going to share with you 6 areas of health and wellness news and information. Somewhere around this video, you can read through all 6 of those areas. If you have any questions or you'd like a copy, you can DM us on social, send us an email, or give us a call here at the clinic. We'll be sure to help you with that. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, a little bit of information may help direct you with your own health choices, actions, and decisions throughout the day to support some changes you'd like to make to see something perhaps improve and or just to stay well into the future. It's always time and effort well spent. Today, we're going to look at what the Arthritis Research and Therapy Report had to say in March 2021 about the poor diet of people who could be at increased risk for knee osteoarthritis and disc degeneration. In a recent animal study, researchers observed that mice fed an obesity-promoting, high-fat, high-carb, Western-style diet developed higher levels of inflammatory markers in the knee joints and spinal discs, indicative of the degeneration of cartilaginous tissue. The findings suggest that adopting an anti-inflammatory diet may reduce an individual's risk for conditions such as osteoarthritis of the knee and degenerative disc disease. So there are some foods to include to help with inflammation and some foods to avoid if we're trying to keep inflammation down. And you can Google those. There's some good lists out there from places like the Mayo Clinic, and you can follow an anti-inflammatory diet, especially you or someone you know already is predisposed to and or has been diagnosed with some kind of osteoarthritis and or disc degeneration in the spine. Speaking of nutrition and poor diet, the Nutrition Journal, April 2021, looked at eating out and dietary insufficiencies. Questionnaires completed by over 2,000 adults revealed that the more meals an individual consumes that are prepared outside the home, the more likely their intake for dietary fiber, vitamin C, vegetables, iron, magnesium, and potassium would be considered insufficient. So generally preparing your meals at home, especially with recipes that require a variety of foods, can increase the likelihood that you're getting your daily nutrients. Eating out, just the way foods are prepared and the economy of that industry, that's less likely to get exposed to all the different types of foods that may provide you with the nutrients that you need. The Journal of Endocrinology, May 2021, looked at low vitamin D and how it may hinder mitochondrial function. Those are the energy-producing components of the cells in your tissues and your organs and your body parts. An experiment involving mice revealed that skeletal muscle mitochondrial respiration is impaired when vitamin D levels are too low, which suggests that improving vitamin D status may increase an individual's exercise capacity. So low vitamin D, those mitochondrial, they have a hard time generating energy because of the way they need to take in different nutrients and maybe even oxygen, which is a source of some of that for that engine in those cells and tissues, including your skeletal muscles that move your body. But making sure that your vitamin D status is within normal limits may help those muscles work better and increase a person's exercise capacity. Kind of cool. The Journal of the American Medical Association, Network Open, April 2021, looked at women who are more likely to suffer long-term effects after a concussion. A review of health records of over 2,000 concussion patients revealed that women were more likely to experience symptoms such as fuzzy memory, difficulty concentrating, headaches, dizziness, or fatigue a year after the injury. Further research is needed to identify why females may be at increased risk for long-term concussion symptoms. Certainly, if you've had a significant head injury, been knocked unconscious especially, you would want to see someone who specializes in concussion. Quite often there is a neck component, and some forms of manual therapy do help with that, but there are concussion clinics. We happen to have one here in our building, and they specifically work on helping to recover some of that cognitive function that can come with having suffered a concussion. So if you have any lingering effects from that or know somebody who has but is not pursuing continued improvement, there are some avenues to explore, and I wouldn't stop short of trying to get as good as you'd like or can get. The journal Cancer, April 2021, looked at teens using tanning beds and what happens if we ban that age group from using them. An analysis on the impact of banning tanning bed use by adolescents found that it could prevent over 15,000 melanoma skin cancer cases in the lifetimes of the current crop of teenagers in the United States today. A lot of debate on that issue as to whether or not some of them may be safer than others, and what kind of exposure is healthy and or better, worse than being in the sun with or without any kind of base in terms of going out in the sun. So probably something to certainly research and to talk to qualified healthcare provider with some guidance. But certainly overexposure to anything that is not good for us can create some problems. So we just want to be sure that we're doing the right thing when it comes to making those decisions. Finally, Journal Healthcare, March 2021, looked at cervical mobilization that offers benefits to stroke patients. Among a group of 24 stroke patients with forward head posture and impaired respiratory function, researchers observed that 3 cervical spine mobilization treatments a week for 4 weeks resulted in improved cervical posture and inspiratory function, the ability to breathe air in. Cervical mobilization is a common manual therapy used by many healthcare providers and could be of benefit in this case to some stroke patients. So that's kind of cool. Another interesting thing. So that's your daily health update for Wednesday. Hopefully there was some good information there for you to keep navigating in the right direction with having those great experiences you're trying to create every day by keeping your body healthy so that it's ready to support you in having those great experiences, of course. All right. We'll be back tomorrow, Thursday, with your last video daily health update for the week. We'll throw a written format at you on Friday for the weekend, and then back to the normal routine next week. We'll keep you plugged in and make sure that you're supporting your health and wellness. Happy to do it. Hope you enjoy it. Enjoy the rest of your day. Take care. We'll see you next time.